It's Shelly's Nursing Review on HGTV. And today we're going to tackle some chronic GI. Now, as you know, if you follow me on either Instagram or Facebook or whatever, you know that I have an HGTV YouTube channel, and that channel is based on playlists. So my playlists are separated in terms of subjects. So there's acute GI and there's chronic GI, right? If you look in my playlist, we're doing chronic GI today, just to separate those two in your mind. Remember, like acute GI are things that you have to go to the hospital for. They're going to admit you. It's life and death, yada, 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 right? So pancreatitis, bowel obstruction, peritonitis, you know, ruptured whatever, right? So you get it. Perforations. Yeah. Appendicitis, you know. Well, that's not what we're doing today. We're tackling some of the chronic problems that patients have in their GI system, which is really near and dear to Americans because we have a shitty diet, and I've already told you we drink way too much alcohol. In fact, 1 in 6 hospital admissions are alcoholic. So as a nurse, we all know that. And so as a nursing student, I'm trying to prepare you for that. So this lecture will prepare you for NCLEX or nursing school. It doesn't matter, whatever. Or even just being a person who wants to get their shit together in their GI department. Hello. Now, so if you look here, today's topic is gastritis. We're also going to tackle peptic ulcer disease because I'm one of those people who learns better if I understand what system in the body controls everything and then what disease leads to a complication of another disease. So I'm going to tie all that into this lecture. I want to start by just reminding you about digestion, and that when I say gastro in any way, shape, or form, I'm talking about one body part only. I'm talking about the stomach. So, you know, if you throw out that term gastritis and you say, oh, it's the GI system, well, not really. Let's narrow it down to the stomach. So if I'm thinking about gastro anything, gastroschisis, gastritis, gastric ulcer, whatever, it's stomach related, gastric cancers, stomach cancers, okay? So I'm talking about today gastritis. And you already know that itis means an inflammation of that body part. So we're talking about a very inflamed stomach. And there's lots and lots of things that we know can cause it, but I always narrow it down to just a few because what my experience has been is that students confuse a lot of terms together. You confuse causes with risk factors, with signs and symptoms, with complications, with, you know, diagnosis. I mean, you just go all over the map. So I'm going to try my best to help you narrow down exactly what those terms mean or how to use them when we're talking about an NCLEX exam or a nursing school test. So when we look at causes, actual causes of inflammation of the stomach or gastritis, we're talking H. pylori is number 1. Now, Helicobacter pylori, big fancy $4 word, H. pylori is an infection. And you know, you can get this infection anywhere, anytime, anybody. It's weird. A lot of people have this H. pylori. It is easy to test for, but it is a number 1 cause of gastritis and even peptic ulcer disease. The next cause is something near and dear to my heart, which is NSAIDs. Now, you've got to be really good at this, guys. You've got to know how to separate your NSAIDs from other medications. And it's been my experience that patients and students have no clue how to do this. So give you an example. I had a student who she was getting, she was having some bleeding rectally. She was having some she was throwing up blood. She was anemic. She had to go in for an endoscopy and a colonoscopy, and they showed her colonoscopy and endoscopy results, and they said you have gastritis and you have erosion of your lining of your stomach and you have an ulcer and you have all this stuff going on. And she's like, well, how did I get that? And they said, well, there's a multitude of things. And they asked her this question: do you take NSAIDs? Well, she hadn't been in my class. In fact, she just kind of started nursing school. And she said, no, and then they went on into the long list of different things they asked during a history and physical. And so it wasn't until a follow-up visit with a nurse that the nurse knew better and did not say the word NSAIDs, because the general public, and maybe even your crazy behind, don't know what NSAIDs are. So this nurse was smart. She came about it very differently. This nurse, in her follow-up exam or follow-up visit, said to this same nurse, same student at the time, she's a nurse now, has been forever, but she asked her, do you get frequent headaches? She goes, all the time. She goes, how bad are they? Oh, they're like on a scale from 1 to 10, they're always 8 and above. They're really horrible headaches. She goes, oh yeah, what do you take for them? She goes, well, either Aleve or, Motrin or, Advil or something like that. She goes, oh, okay, so you take the NSAIDs. She goes, oh, that's what that is? She goes, I think somebody asked me about NSAIDs before they did my workup for my colon and stuff. And she goes, yeah, I guess I take NSAIDs. She goes, yeah, those are really bad. Why are they so bad? We have something called prostaglandins in our body, and they are hormones or chemicals that protect the lining of our stomach. When you take Advil, Aleve, Motrin, ibuprofen, naproxen, you say tomato, I say tomato. When we take those medications, they completely inhibit prostaglandins. And when you inhibit or stop or block prostaglandins, you allow the acid in our stomach to literally destroy the mucosa. And when you destroy it to a certain point, you destroy the ability to even make the acid, because you've destroyed the muscle and the lining of the stomach in such a degree that the parietal cells don't work in terms of secretion. So that's a lot to say, but the bottom line is Advil, Aleve, Motrin, ibuprofen, naproxen, whatever. Lots of those names double over. They are just saying a different type of medication, because you know that Motrin and ibuprofen are the same. You know that Aleve and naproxen or naproxen are the same, but your general public doesn't know. So you've got to say all those words to get at the root of the problem. Sadly, that young lady that said she takes those medications all the time, she was confusing, like you do and our patients do and our laypersons do, the dosaging, right? So you gotta know that when we talk about ibuprofen, Motrin, Advil, Aleve in that big old, one little sentence, they're nothing alike. So ibuprofen, Motrin, and Advil, they're alike. Okay, they're all ibuprofen, okay? So the dosage is the same. The problem is the general public thinks take 2 of anything and it's going to work really well. And then when it comes to over-the-counter medications like these NSAIDs, people think, oh, you just take 2 every 4 to 6 hours. Wrong answer. For Aleve, are you kidding me? That's every 12 hours. You can start with 2, but you need to take that every 12 hours. But I got the general public, including my classmates or my students, if I ask them, and I've done it a million times, I go around the room and I ask each one, how would you educate a patient who calls you to take Aleve? And they always say, oh, 2 every 4 to 6 hours. Really? Well, you gave her a GI bleed. You gave that patient gastric ulcers. You gave that patient gastritis. You might have killed that patient, because if they keep doing that for every headache they get, and they get a lot of headaches, well, we're going to have a little problem here with our GI. So again, Aleve is in a different category. It is not 2 every 4 to 6 hours. In fact, none of them should be every 4 hours anyway. Let's just be clear of that. The Aleve is just, take 2 initially if you're dying just about. I mean, really 1 would work, but if you're dying and this is serious and crazy pain, take the 2, and then you're every 12 hours for Aleve versus every 6 to 8 hours for the others. Okay, that's free. I gave that to you free. You didn't have to pay for that. Okay, so NSAIDs are going to literally destroy the lining of your stomach in a really, really fast manner, okay? So patients who take these for arthritis, headaches, and that young lady who was taking it for the headaches, I think the bigger problem that I want to share with you with that student is that the reason why she had the headaches in the first place, which the nurse very astutely cornered in on and targeted to use as an area of focus. When she asked about the headache, she asked her how long had they been going on, and she told her when, and was there anything that might have related? Well, I hurt my head. Well, how did you do that? Well, I got into it with my boyfriend. Yeah, he caused her a concussion, because after this young lady, my student, told her nurse that she's got these really bad headaches, CAT scan was done and it shows a concussion. And so she received a concussion through domestic violence or partner violence, intimate partner violence. Then she got all these headaches, and then she took all these NSAIDs for the last couple years, and these NSAIDs destroyed the lining of her stomach. So now she's diagnosed with a gastric ulcer. It's crazy, okay? So just, hang in there with me. Number 2 is NSAIDs. They can destroy the lining of your stomach. But then number 3, yes, Jesus, yes. Good old alcohol. You Hennessy players out there, Jack Daniels, yeah, that part. So, I keep saying to my beloved students that they have to go all the way back to when they were maybe a teenager, or even 12, since that's pretty average age, 12, 13, for your first drink and first smoke. If you go all the way back to 12 or 13 and you took that sip of alcohol, it burned going down. It felt like shit, actually, and you were like, oh, ooh, that kind of thing. But now you're 30, you're a lush, you like the taste and the feeling, right? So if you're honest and you think back to when you were 12 and 13, that feeling that you got was actually a burn. You see, alcohol is a chemical and it burns going down. So when you drink alcohol, it burns whatever tissue it comes into contact with. It's a toxin. That's why your liver is needed to detoxify it. And so when you drink, you burn your throat, you burn your esophagus, you burn your stomach, and you continue to burn all the way through. But specifically, those tissues are literally burned. And so the mucosal layer is just inflamed and burned and destroyed. And here we have this problem again with our patient having quite a bit of difficulty with the lining of the stomach. And if they're a real serious drinker, this is just going to turn into chronic gastritis, okay? So I hope you kind of understand the role that these 3 play: infection, medication, lifestyle, okay? Now, risk factors is not the same thing as causes. Risk factors, and I hope my little baby girl is showing you these words real quick, because these words here are big in terms of separating the causes from the risk factors. Smoking. This is what I always tell my students. For every cigarette you smoke, an hour of vasoconstriction occurs, which means that you're not getting blood flow to the tissue. If you're not getting blood flow to the tissue, you're causing what we would call ischemia, or lack of perfusion. And this stomach tends to be destroyed, the lining and everything else, and the function of the stomach doesn't work well. And so every cigarette you smoke, and God forbid you do what my parents did, which was 2 to 3 packs a day. Oh my God, there's only 24 hours in a day. So if you smoke 2 to 3 packs in a day and you're sleeping maybe 6 hours, that whole day you're causing no blood flow to the stomach. But nowadays people know that 2 to 3 packs a day is outrageous. So most people, when you look at this gastritis connection, they may smoke a half a pack, a whole pack a day. They're still causing very much destruction to the tummy. You are also causing some just lack of immune system, right? So you know that smoking decreases your immune system. You know that it's going to let infection go crazy. And so it's a lot, right? Another risk factor is stress. And it's weird because when you get stressed, we're talking a person who has more vasoconstriction. And remember what we're saying. We're saying vasoconstriction, again, is causing your vessels to close up or narrow to such a degree that you cut off the blood flow to tissue. And when you're stressed, you produce catecholamines and you go into this fight or flight type of response, and you cause that vasoconstriction all over again. So, you know, this is a lifestyle issue. This is a lifestyle issue. And for those patients, meditation, yoga, Tai Chi, it would work really well to kind of engage in some of that, try to alleviate your stress. Maybe it's a job change. Maybe it's kicking the kids out the basement. I don't know, breaking up with your boyfriend, or you're sleeping with the enemy. I don't know, but that's a whole nother lecture. Okay, folks, so let's keep it moving. What about caffeine? And here again, it's very simple. Caffeine vasoconstricts. So if you're doing that whole, what did my patient tell me? She drank 14 to 20 Diet Pepsis a day. Yeah, wow. Okay, boo, you just vasoconstricted as much as smoking a pack of cigarettes, because every can of pop you drank vasoconstricted. So, you know, you got to be careful with caffeine. Coffee, I have the 1 cup or so a day, and I just, you know, that's it. I can't be drinking pots and pots of coffee, but I get people that do, because I didn't even start drinking coffee until I became a nurse. You got to stay up all night, and then you like to drink it to get ready for the day, and it gets old, right? It's caffeine, okay? But in moderation, you're good. So don't throw the baby out with the bathwater. I don't have a problem with the gastritis issue. I drink coffee every single day. I just don't drink 3 pots, okay? You feeling me on that? All right, now the last one is diet. It doesn't, again, these don't cause gastritis. These aggravate it. These are risk factors for it. So let's just say that you and your lovely little self, you like your Cheetos fiery hot. Yeah, let's say that you carry hot sauce in your back pocket like Beyonce. Let's say that you like your hot dogs and hamburgers and catfish charred every day, not just when you go out to dinner for an anniversary or birthday. No. You eat burned hot dogs all day. Yeah, that's what you do. Let's say that you, I don't know, you like your spices. You just shake, like a Polaroid picture, you know, back in the day. You shake all kinds of spices on everything, especially pepper. Yeah, well, I'm talking to you. When you do and engage in all this spicy type of behavior, and especially the hot stuff, I mean, you are first in line at Chipotle for the fiery hot salsa and the Tabasco this and the wasabi that and all this other kind of crazy shit. Well, yeah, you're going to definitely make that mucosa angry with you and tear up that lining. It's not going to cause it. It's just going to make whatever you got in there from your Nsaids or your alcohol or your H. pylori, it's just going to make it a lot worse. I have a beautiful niece who had fiery hot Cheetos and fiery hot wings and fiery hot this and fiery hot that. And at a very early age, starting around 13, yeah, she got diagnosed with gastritis. So, you know, she was not the alcoholic. She definitely didn't have any kind of crazy stuff going on with H. pylori. So, you know, she kind of destroyed her lining, and maybe she was doing a little Nsaids or something. But other than that, we point specifically to really hot, spicy foods. So you already know where we're going. You know that if I can tell you what the risk factors are, and if I can tell you what the causes are, then over here at the treatment, we're going to be including not doing this crap, right? I mean, it's just common sense. All right, so let's move on, because we are talking about gastritis. We are trying to help you know how this is going to help you on your NCLEX, or trying to help you understand how this could help you with the unit test in school. We are talking about the gastritis that people have in America, lots of people, is chronic. It's part of the chronic GI system. We told you to go to the playlist to find all this. We said that when it comes to your gastritis, there's causes versus risk factors. Those are not the same terms. You had to be very careful with that. And now we can move on to complications. Now, let me just say that the complications of gastritis can lead you right into acute GI, meaning your ass has to be in the hospital and your ass needs like serious care or you're gonna die, okay? So complications of gastritis. Number one, peptic ulcer disease. Oh yeah, you could easily get PUD, which is what we call it, peptic ulcer disease, PUD. You could easily get a gastric ulcer from this hot ass mess, right? You could easily become anemic because I don't know if you remember your digestive system, and certainly I have many videos on that, but let me remind you of a couple things just in case it slipped your cute little mind. Here's our problem when it comes to messing up that lining of the stomach to the point where you're barely producing a whole lot of acid. You need hydrochloric acid to absorb 4 nutrients: iron, vitamin B12, calcium, and vitamin D. When you tear up that gastric lining of your stomach and you destroy it to a certain extent where the function of the stomach does not do well, you decrease the hydrochloric acid and you get to a point where you're not absorbing iron, B12, calcium, or vitamin D. If you're not absorbing iron, you can quickly become anemic. If you're not absorbing B12, you can quickly have a decrease in your intrinsic factor, making you become vitamin B12 deficient, and that is called pernicious anemia. With either one of these, especially pernicious anemia, you can get to the point where you put yourself at risk for stomach cancer. When we look at the last complication, it's pretty bad. This is where I work all the time. On my regular med-surg unit that I work, soon to be PRN, and that med-surg unit, I get patients with GI bleeds all the time. Inevitably, they have that history of Nsaids. Inevitably, they drink probably more than the average person. Inevitably, they have almost all of these every single time, and they come in with the GI bleed, and we don't know yet whether it's due to cancer, gastritis, an ulcer. We don't know yet, right? They're just on my floor getting worked up for a GI bleed. And so the GI bleed comes in because if there's an ulcer, it can bleed. If it's gastritis, it can bleed. And again, that's not going to make anemia any better. So if you're having a GI bleed, then you're going to become more anemic. Like seriously, this is crazy. Now, the GI bleed can be really serious. And I mean really serious. What kind of GI bleed? Well, that's where I need you to put your thinking cap on. So the stomach is very, very, very close to your esophagus and your throat and your mouth. So if you have gastritis, you will probably have this fancy $4 word, hematemesis, meaning you're throwing up blood. Maybe you even have coffee ground emesis. Okay, so either bright red blood, hematemesis, or coffee ground emesis, because as the blood sits in your stomach, it starts to go through a little bit of digestion. Some blood that doesn't come up out of your mouth in the form of emesis will go and move through the digestive system and kind of get digestive all the way through, because blood is a protein, so it's digested like a protein. In that patient will have melena, and you probably remember that melena is dark, tarry stools. So all of these are a GI bleed, right? Hematemesis, GI bleed. Coffee ground emesis, GI bleed. Melena, GI bleed, right? It just depends on where in digestion the blood is. But you can see that if it's significant enough and you're just doing a whole bunch of bleeding, well, guess what? you're losing your blood volume. And what did we teach you? We taught you that blood volume and volume of any fluid in the body controls your blood pressure. And then if you're losing all this blood and you're so anemic and your blood pressure drops, well, that's shock. That's what it is. We know that all shock, y'all with me? Remember the golden rules? Y'all know. All shock is a low blood pressure, all of it. Not one shock in the world has a high blood pressure. No, all shock has a very low blood pressure. And so it's not uncommon for me to take this patient who comes in with a GI bleed and have to transfuse them a few units while they're on my floor, and then end up sending them down for a diagnostic test or two to figure out why are they bleeding. And when the diagnostic test comes back, only to hear that, oh, they have gastritis as their overall reason for all this hot mess, or even a gastric ulcer. Now, never fear. The next lecture will be the gastric ulcer, the duodenal ulcer. So we're gonna do like PUD and all that stuff next time in the next video. But for right now, I'm focused on just simple gastritis, okay? Now, so what did we do? We did our causes, we did our risk factors, we did our complications, and we kinda did signs and symptoms, but we need to finish it, okay? So here we are. Signs and symptoms of gastritis. Signs and symptoms of gastritis include epigastric pain. Now, if you stuck on stupid and parked on dumb and having some precious moments this morning, perhaps you haven't had your bagel and coffee, let me show you what I'm talking about, right? Because we got to do this. You and me, we got to work this all the way out. Now, many of my videos give you a nice trick. Today, you're going to get the trick again, because repetition is good for the soul. That's what Paul said in Corinthians. So here we go. I want you on something you will not lose, preferably your GI packet, to write down this little, I call it a cross or T or whatever you want to call it. Okay, this is your stomach, all right? We'll kind of erase a little bit over here, and we're going to go like this. Now, here we go. If I stand here just like this, and I'm showing you this picture on my board, what I did was I reached from the xiphoid process, and I took that line all the way down to my pubic bone. And then I took these lines from my side all the way through, and I intersected right here at my belly button. Oh, I'm sorry, umbilicus. But the belly button is the center of the abdomen, okay? So you got this. So watch this, you guys. This part here is, here we go, this part here. And this part here is my right upper quadrant. And then we go down. And this part here is my right lower quadrant. Now, that did not take a PhD, so you ought to be all right. Let's move on over to the other side of the body. This quadrant is my left upper quadrant. And this quadrant, of course, is my left lower quadrant. Your job, my love, is to remember the trick. The trick is called glass. We're going to take glass, the word, and put our organs in each letter at a time. So in the right upper quadrant, we have a G and an L. Very important, because the letters are strategically placed by each other in the same way that the body parts are placed in your body. So the liver is here, and up under and behind the liver is the gallbladder. So GL, which is part of glass, gallbladder, liver. Right lower quadrant, appendix. That's your A. This S over here, because you know your girl is raw, you didn't know me long enough to know I got issues. This would be shit. Okay, fine. sigmoid colon if you want to be proper. Okay, so shit or sigmoid colon. This S is your stomach. Now, be careful. Gallbladder, liver, appendix, sigmoid colon, and stomach are GI organs. But if you want to be extra fancy, you can throw an extra S over here for the spleen. The spleen is not a GI organ, but it's in the GI cavity in the left upper quadrant. It's important to just kind of know that's there, but it's not part of the GI system, right? So you know that. So here's our deal. If I tell you that the pain is in the epigastric area of the belly, and I didn't say right lower, left upper, right upper, I didn't say any of that. I said the epigastric area. Where in the human body is that? That's you putting your hand right on the top of your stomach, and this pain will be very gnawing, very aggravating, very burny type of pain. This is that epigastric area, but there's something else in that area, so I put a big, huge umbrella type diagram with an arrow that way. So watch what I do. This organ is the pancreas, and the tail of the pancreas always moves to the left. People with pancreatitis or pancreatic issues, they'll have pain in the epigastric area, but it'll radiate to the left. If it's just pain in the epigastric area, it's not radiating one way or another, it's probably good old-fashioned gastritis. And again, this is epigastric area, okay? So gastritis will hurt in the epigastric area or at the top of the tummy, and we're gonna put that fancy $4 word. Epigastric. Now, didn't I tell you when I started this shit that every time I say gastric, you're gonna think stomach, okay? Now, I want to point out something very important. So hold on for 2 seconds. My girl's gonna come in here closer, and I'll be right back because I gotta get this handout to show you what page you can take these notes. Shame on me for not telling you sooner. And again, like I said, shame on me for not kind of pointing it out sooner. But this is a page in this packet, and I know you're gonna kill me because I'm doing this kind of late, but this is a page in this packet that you have, or if you don't have it, I'll send it to you. Of course, there's a cost. We give you the Oh My God packet for free, but if you need any of these packets, it kind of costs a little bit. So if you look at this page is called sucralfate, carafate. This is a medication that we use to treat gastritis, and I use all of my notes about gastritis. I put them all on here. Now, just in case you don't know how to take notes, I'll show you how crazy your page is gonna look. This is my page's notes on gastritis. It has all kinds of colors separating, you know, subjects or whatever. And so you can put those notes in that packet. If you didn't have a packet, it's okay, but you need to know for every video that I do, I have a packet for all of them, okay? Now, we're moving on and we're almost done. We have epigastric pain. I just showed you the glass trick. We have dyspepsia, and that's a very fancy $4 word for heartburn, GERD, reflux, heartburn, whatever you want to call it. Some people even have hiccups. Some people have the bleeding that we mentioned earlier, and there's that anemia. Now, I do want to say something about that anemia because, again, if you live as long as I do as a nurse, you diagnose a lot of people with a lot of things right in your face, in school, at work, whatever. So I had this young lady in my class, and she was mentioning how her husband was scheduled for some workups. She wanted to take a day of class or whatever off of class. And she told me that her husband had been going through a situation where he was anemic. And I said, oh, I don't like that. She goes, what do you mean? It's been going on for a while. They didn't seem too concerned until now because it just keeps going. I said, well, how long has it been going on? She said, a couple years, almost died. So let me just help somebody out here. If any adult male has anemia, if any adult male has anemia, it's colon cancer until you prove that it's not. I pray that you heard me loud and clear. Any anemia in any adult male, because women have other reasons for anemia like periods and fibroids and everything else, but we're talking men here. Any adult male with anemia has colon cancer until you prove they don't. The workup that you took a day off of class for ended up being stage 3 colon cancer. Her husband did die 2 years later. And I fault medical personnel or nursing personnel for not jumping on his anemia 2 years earlier. Just frightening, okay? May have had to do with, disparities in healthcare that we see with African American males. I'm just keeping it real because I need you to know that too. All right, so we're moving on. Now, letter E, diagnosis. The gold standard to diagnose gastritis, or for that matter, anything in the stomach, is an EGD. Now, we always run around here talking about EGD, but you have to know, my love, what that spells out to be. And again, I have a procedures packet, if you like, which spells out all the different 700 procedures that we do as nurses. But for now, it's called esophageal gastroduodenoscopy. Just think it through. Esophagus, duodenum, stomach, gastro, right? Told you that earlier. So esophageal gastroduodenoscopy will be the gold standard. And this esophageal gastroduodenoscopy, this EGD, is done always with biopsies. When we do the biopsies, we're looking for H. pylori, cancer, and anything else we can find. Very often the diagnosis will come back from those biopsies as gastritis or gastric ulcer or whatever. So EGD with biopsy, gold standard. The urea breath test, it's kind of crazy. You blow into this like balloon bag and they check the CO2 level after you do that. And then they give you like this lemony drink of urea, really? Don't go there. But they give you the drink, you drink the solution, and then you exhale into this balloon bag again, and then they check the CO2 levels there. And so if the CO2 levels are higher in the second sample from what you blew into the bag, the balloon bag, then you have a positive active infection with H. pylori. So it's kind of cool to make sure that you know, okay? Now, stool for occult blood might help in trying to figure out how bad is the situation. Certainly if you have a positive occult, then, if your occult test is positive, which would show up as blue, remember negative is green. If it's positive, well, then you might have an ulcer. You could have anything really. It could be cancer. Again, biopsies will tell you what's going on. Now, the treatment. The treatment is going to be part of my pharmacology session that I do with you on GI meds. But for right now, let's just give you the quickie. We're going to include, for treatment, lifestyle changes. You're behind, need to leave that Hennessy or Jack Daniels or whatever the hell you're doing, Cabassier, Bacardi, whatever. Leave that shit alone. Stop drinking. You ain't gonna never touch an NSAID again, ever in your life. So your method of pain relief is gonna be Tylenol and nothing else. You can't have that Advil, Aleve, Motrin, ibuprofen, nothing. Stay the hell away from it, period. Okay, so no alcohol, lifestyle, no smoking, lifestyle. Get your little stressed out ass together. Go on in that Tai Chi, yoga, meditation. Kick them folks out the house. Stop sleeping with the enemy. Get you a new job. Do something, honey, because it's going to kill you. Okay, so stress relief, right? Lifestyle, stop drinking coffee. Stop the 14 Diet Pepsis or whatever the hell your little ass is doing. And let me just say for people who don't get it, Mountain Dew has the highest caffeine dose of anything outside of caffeine drinks. Some of y'all are stuck on this whole monster and you become a monster. You're doing 5-hour energy and you didn't cut your little life down to 5 hours doing that. Okay, so you're doing all this caffeine, and I get it, nurses need it, but you're gonna cut yourself off here in your lifestyle here because you gotta stop. Your stomach hates this stuff. And you and pepper and Tabasco and hot sauce are gonna break up. Yeah, y'all gonna have to go ahead on and have a love affair of nothing. You need to break up with them because you can't be shaking the hot sauce, wasabi, and Tabasco and pepper and paprika and bell peppers and onions and all them spices. You gotta leave them alone. So we talked about the diet, right? No tomatoes for you. No citruses for you. Why? Because it's acid, fool. No, no, no. You're not doing that, okay? Now, meds. You know, I don't like meds that much, but you got to use meds at some point for these patients. And that is important because if you got so far gone where you got an ulcer, you might be on some of these meds till you die. Sucralfate is a really wonderful medication that coats the lining of the stomach, and that's the handout that you see. It has to be taken on an empty stomach. You can't combine it with any antacids or anything else, and it works really well for simple gastritis. If your behind was bleeding in any kind of way, any kind of GI bleed or whatever, you're going to be on a PPI for a long time. Now, what the fuck is a PPI? Proton pump inhibitor. This is your Nexium, your Prilosec, omeprazole, right? That's a fancy $4 word. Esomeprazole, whatever the fuck, you know. Omeprazole, I say that pretty well. I ain't got to keep going on and on with this stuff. But they all end in prazoles. Those are your PPIs. Your H2 inhibitors, your histamine inhibitors. This is going to be your Zantac, your Tagamed. These end in Tidine, Tidine, Tidine. So I always say to dine out at night at Cheesecake Factory. Before you do any of that, you're going to need a PPI or a H2, Prazole or Tidine. These two must be taken first thing in the morning, empty stomach. Early in the morning, empty stomach. I hope you heard me. You cannot eat with these. So 1, 2, 3, empty stomach. Antacids, magnesium-based antacids, Maalox, Mylanta, whatever. Antacids are taken after the meal. Think A for antacids, A for after meals, and you'll be okay, okay? No Tums. People don't know no better. They go out here and they get a bunch of Tums. No, that's not going to work for you. Tums is calcium carbonate. That's not going to work. It's going to cause a rebound. So no Tums, okay, for this condition. Now listen. I hope you heard me loud and clear. Don't forget, if you don't know, you get a complimentary Oh My God packet, which is the best study guide. It's got labs, it's got meds, it's got selectols on shocks, it's got all your systems in there, it's got your who do you see first, it's got your delegation, it's got prioritization. If you need a complimentary Oh My God packet, you already know you've got to email me at CHELLYS NCLEX PREP, and let me just show you how that goes on the board here. Some of y'all don't be knowing. CHELLYS NCLEX PREP at gmail.com, or simply call me 216-410-0936. There you go, boo. Don't say I don't love you. Who else is giving you free shit? I mean, come on now. Deuces.